So, aloha. I'm Dr. Taketa-Wong. I'm pleased to be joined today by our associate, Dr. Anderson, for this very important and eye-opening video about children's mental health. So, sadly, autism, anxiety, depression, behavior problems, and other mental health concerns are afflicting more of our keiki. For naturopathic doctors, fortunately, all of these brain, gut, neurological conditions have similar treatment protocols. You'll learn all about them at this live event. So, Dr. Anderson, can you tell us a little bit about what's important when we're thinking about these kind of the mental health conditions? Um, yeah. So.
So, a lot of the conditions you're talking about, um, in in regular medicine, psychology, psychiatry, counseling, they help our kiddos to understand and come to terms with their concerns. But what you have to think about, and what we discover in naturopathic medicine, is that many mental health conditions actually have their roots in physical imbalances.
Yeah, and I think that's important to know is because a lot of times it's easy, I think, for parents to get really frustrated or just say, why don't you just snap out of it or just be positive. But then, understanding there that both for children and for adults, that many times mental health conditions really can have physical things that are going on in a very real way, that it really needs to be treated by really looking and treating those physical imbalances that are going on.
Oh,
And
absolutely.
yeah. And then now these kinds of things, anxiety, a lot of kids aren't going to come up and say, I feel anxious, So what should parents be looking for in their children when there's these kinds of concerns?
That's a great question. Because in kiddos, these conditions don't usually present like they do in adults. So kids might lose interest in things they normally like doing. They might withdraw and want to be alone, not want to hang out with their friends. They might have trouble sleeping. They might experience changes in their appetite. So some of the same things, but kids don't always have a way to explain what they're feeling. They don't always understand what's happening. So sometimes looking for other changes that are out of the norm for that child.
Yeah, and I think one of the things I've really seen is that a lot of times if there's behavior concerns, um, that's the behavior is really just a message. It's a communication to us that hey, there's something going on, and a lot of
Mm-hmm.
times the child doesn't really understand what is going on in their body, but that it's something that can be a message to us to see like, okay, I mean, counseling, behavioral therapy can be helpful, but oftentimes if there's physical imbalances, it'll show up in behaviors with their
Mm-hmm.
kids, with our kids. And so I think
Oh,
that's an
yeah.
important thing to pay attention to. And then now let's just talk about how regular medicine treats these concerns.
Yeah. So regular medicine uses what's called a biopsychosocial approach. They use things like talk therapy, parent behavior training, school support, and then sometimes they do use medications. They might use an SSRI, which is used for depression and anxiety, or they might use a stimulant for a kiddo who's got ADHD. So these treatments can be really valuable, and I'm sure Dr. Taketa-Wong will agree with me, especially when symptoms are severe, right? And they're affecting a kiddo's safety,
Right.
their ability to learn. And all these things we're talking about, I'm going to share a few cases later, and these are perfect examples of what we're talking about, or their daily functioning. It can really disrupt the home life. So keeping that in mind, though, with medications, we know that they come with side effects. Even the conventional providers are very aware. Like stimulants in kiddos with ADHD are common to cause decrease in appetite and insomnia and other things you would expect. Um, so we respect, this model, and we collaborate with it. So our role, though, as the naturopath, is to ask a different question. Like, why is this kiddo struggling in the first place? We look for things like nutrient deficiencies, the gut health issues, sleep problems, neuroinflammation, blood sugar dysregulation, stress, and neurotransmitter imbalances. So we don't want to replace conventional care. We want to bring a root cause approach so that we can help these kids not only, thrive, um, physically, emotionally, and mentally, but you have to remember these kiddos are growing at the same time as we're dealing with these imbalances. So we want them to also meet those goals.
Right, yeah. And that's so important, is like understanding what's the underlying causes. Um, and then so next, Dr. Anderson and I will tell you how naturopathic medicine can help our keiki to build a solid foundation for a healthy body and healthy mind, and give you some case histories. But first, um, so when it comes to the best treatment, it's important to emphasize that everyone has a different makeup. So each person needs individually tailored medical solutions. For our viewers, you can call our office to schedule a no-charge medical consultation with me so that I can talk with you personally about your health concerns. And the phone and other contact information is on our Facebook page. If you're interested in seeing Dr. Anderson, she's part of our practice, and so that would be the first step, is having that no-charge consultation so we can make sure that it is a good fit, and about how to individualize things for your or your keiki's concerns. Also, if you purchase vitamins, minerals, herbs, and such, please visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. There's a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. And a link is in the post with this video. So when it comes to naturopathic medicine, we always start with a healing food plan that's tailored to each individual patient. So can you talk about some of the approaches to food for keiki mental health?
Yes, I love this question. You know how much I love talking about nutrition. And this is foundational for how we approach kids, mental health in kids. So we know food is fuel, but it's also information. So every bite of food that we eat sends signals that influence how our brain functions, how our immune system responds, how stable our energy and mood are, even how our gut microbes, our gut bugs, talk to the nervous system. So we have to figure out what's going on, and not every kiddo has the same issue. So that's why doing, blanket diets, saying this one diet is best for everyone, we really go with an individualized approach. Um, One kiddo might have blood sugar swings that are happening that are really driving their mood swings because they're mostly eating processed carbohydrates and they're not eating a lot of protein or fiber or healthy fats. For another kiddo, it might be like food sensitivities, um, that are driving gut dysfunction and leading to nutrient deficiencies that affect brain function and emotional regulation. So rather than putting every kiddo on the same diet, we focus on real whole foods, getting enough protein. Protein is the building blocks for everything. Healthy fats, colorful fruits and veggies, fiber. But we help you figure out how to do that for your individual kiddo, right? And your family, what works for you. Because everyone can find this information online.
Yeah.
But really the difference is figuring out, okay, how do you get your picky 4-year-old to eat all those foods? So the goal isn't restriction, it's we want to create a food plan that gives the developing brain the nutrients it needs to support focus, their emotional resilience, healthy mood, and their nervous system regulation.
Yeah, that's great. And besides food, what are some of the other treatment protocols that help these keiki?
I love this. I'm always reminded when I get questions like this about how many tools we have in our toolbox.
Yeah.
Because it's like, what should I talk about?
Yeah.
You know what I mean? Because there's so many things that we
Yeah.
can do. So the great thing about working with kids is they respond incredibly to really gentle stuff. And I think you probably agree with that. You don't
Yeah.
have to do a whole lot of input. That help, especially things that help to regulate the nervous system and support the body's natural healing. So we like to spend a lot of time beyond nutrition. We spend a lot of time focusing on the foundational stuff: sleep, movement, nature, social connection, and helping to find ways that these kids can deal with their stress that are going to work for them. And hopefully skills that they can take on, take later on into life. Depending on the kids, we might also incorporate tools like herbal medicine, homeopathy. I love flower essences, essential oils. These can all help to promote relaxation, resilience, and emotional balance. I like to use a lot of nervous system regulation techniques, things like Qigong, which I know you love. I love sound healing. This can help kids shift out of this chronic fight or flight into a more regulated state. So kids are really adaptable. That's one of the things I love about working in pediatrics. When we give them the right support, we're often able to see a lot of progress in a short period of time and get them better and give them skills that they're going to be able to take, you know,
Yeah.
forward with them.
Yeah, and I think that's the amazing thing is that just seeing, these kids, I think most people just think that the only options are, medications and talk therapy, and those,
Right.
like you said, can be very helpful, but there are many other options, those aren't the only options. So it's just, realizing that. And
Yeah.
yeah, so let's let some of our viewers know about some of the case histories and how well the overall naturopathic treatment worked.
And I think these both, the ones I happen to choose, both speak to what we kept circling around back to. One of them being a case where it was purely a physical um, imbalance driving the anxiety, and the anxiety completely resolved. So that case that comes to mind, it was an 11-year-old girl who came with significant anxiety that seemed to come out of nowhere. This was not a typically anxious kid. Along with anxiety, she had some GI symptoms. So she had reflux, gas, bloating, tummy pain, and she was increasingly becoming sensitive to more and more foods, which is something that we hear all the time. uh, so we know there's this strong gut brain connection. She's got, gut symptoms, brain symptoms. So we looked deeper and ordered, comprehensive stool testing and test for small intestine bacterial overgrowth. So she came back positive with bacterial overgrowth, and specifically in her small intestine, which we see a lot being linked with mental, emotional conditions. There's a huge component of neurotransmitter production that's in our gut, right?
Yeah.
So we treated the SIBO. We gave her foundational support in the beginning to address the acute symptoms that she was having. So the thing with root cause medicine is that doesn't always happen overnight. So sometimes we have to still give stuff right away to help you treat your symptoms while we're investigating, right? So gave her calming neurotransmitters like L-theanine and GABA to help with her anxiety, gave her symptoms to treat her GI distress, which also helped a lot with her anxiety. And then as we did the SIBO protocol, over about 2 to 3 months, she saw probably 75% in improvement. And then by 6 months, her anxiety was completely gone and it has not returned. So, that's the cool thing about this kind of medicine is, it's not always a slam dunk, just a physical thing, but in some cases, um, it really can be. And then one other case that comes to mind, it was a recent case that I took on, a 7-year-old boy who had pretty severe ADHD and behavioral challenges. So his impulsivity, anger, and his aggression had become so intense that he wasn't able to go to school anymore. So mom had to start homeschooling, and then that had become so incredibly overwhelming for the parents that they were just sort of at the end of their rope with everything.
Right.
So instead of just focusing on that diagnosis, we started for looking for why is his nervous system struggling? We ran a neurotransmitter test, which these are so helpful in a lot of these cases. We ran a stool test and some blood work, discovered he was severely anemic, and treated him for that. Started him on some support right away for neuroinflammation, and then actually worked with his pediatrician to get him on guanfacine. So this was all before we even got the test results back. And I share that because we don't even have all the test results back, but I just talked to mom and she said within 2 weeks, he's already significantly better just from that stuff. But we got the neurotransmitter test back, and guess what? You can probably guess the pattern, Dr. Taketa-Wong. He had a lot of really high excitatory neurotransmitters, what I like to call the gas, and low inhibitory, which I like to call the brakes, which is likely driving a lot of this behavior. So when he gets going, it's really hard for mom and dad to calm him down. So we have a very clear plan very clear information to move forward with a plan to help him.
Yeah, yeah, and that's great. So thank you, Dr. Anderson. Your wisdom and your skill really are a gift to our keiki, and just so appreciate your expertise and your experience. And I think it's amazing to see how often that there's kids with behavior issues or ADHD or other kinds of things that come in, and it's just it's just treated just with, okay, here's a medication for ADHD, but there's no workup that's done at all to really figure out what's the underlying cause, and like anemia, right? I think that's a classic example. um,
Oh yeah,
seeing kids with
it's
thyroid issues or other issues where it's like you correct that, and it's like, oh, their behavior's so much better because they're just not feeling good in their body. So
and another one we cannot not mention, especially with the recent storms and flooding that happened, is mold.
yeah.
Mold is a huge driver of behavioral stuff,
Yeah.
especially in kids that otherwise didn't have that
Right.
going on.
Yeah. Yeah. So definitely, I've seen a lot of children and adults with mental health concerns from mold exposure, for sure.
Yes.
So yeah, definitely. So for our viewers, I trust our conversation about children's mental health has been valuable for you. With our no-charge medical consultation, you're welcome to talk with me personally about any health concerns that you may have, so that you too can be empowered with your health. And all the contact information is on our Facebook page. If you purchase vitamins, minerals, herbs, and such, please visit our online supplement store, which is on our website at drtaketa-wong.com. There's a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. And a link is in the post with this video. So mahalo, and we look forward to seeing you in 2 weeks. Aloha.